I'm Dimitri Daskalakis, the Deputy Commissioner for the Division of Disease Control at the New York City Department of Health. I am pleased today to welcome you to our Pride Month Facebook Live on the very important topic of LGBTQ healthcare in New York City. So I'm really excited to be here at the New York City Health and Hospitals Gouverneur on Manhattan's Lower East Side, which just this month opened a new Pride Health Center. I'm joined by some of my friends and colleagues to talk about the healthcare services that we offer here and other parts of the Health and Hospitals group to LGBTQ New Yorkers. So before we get started, I'd like to introduce our illustrious panel. First, we have Dr. Richard Green, a primary care physician at Bellevue Pride Health Center. And not to say that I'm biased, but he's actually my doctor as well. And next, we have Dr. Amina Fatimi, who provides care here at Gouverneur's new Pride Health Center. We're joined by Dr. Mark Bajour from Judson Health Center in Soho, and he provides care to LGBTQ teens and young adults. And we're also very fortunate to have Stefan Rodriguez, a patient at Metropolitan Hospital's Pride Health Center in East Harlem. So with that illustrious group of introductions, let's welcome everyone who's joining us. And for those who are watching on Facebook, we are happy to actually take your questions. So you can just type those right into the comment section of the video and we will try to get to all of them. Also, be sure to like and share this video, the live feed, with any of your friends or family members who you think may be interested in what we're talking about. As we mentioned earlier this month, New York City Health and Hospitals opened 2 new Pride Health Centers, one at Bellevue Hospital and one here at Gouverneur Health Center. For appointments, you can dial 1-844-NYC-4NYC or 844-692-4692. And if you have any general questions or just want to scope out what's going on, you can also email to lgbtq@nychhc.org. If you didn't catch that, I promise to repeat it at the end again, so you'll be able to catch it. So without further ado, let's have Dr. Green and Dr. Fatimi each tell us about the new centers and how they serve LGBTQ New Yorkers. So we'll start with my doctor, Dr. Green.
Thanks. We could not be more thrilled at Bellevue to finally have a Pride Health Center. It's a process that's been like 10 years in making. We have been doing a lot of work behind the scenes over those years. We have an LGBTQ Patient and Family Advisory Council. We have a steering committee to start working on these initiatives. We have support from central office. And so it's about time, and we finally did it. And I'm super, super excited about it. And I'm particularly excited because we've known for years that for LGBTQ people, the thing that is most challenging for us is to get access to care, to affirming care, to people who know how to take care of us. And to remember that people who have different identities among LGBTQ people, so lesbians and gay men and bisexual people and transgender people, each have different needs. And I think it's really important that we have providers who know how to take care of everyone's different needs. And so having that kind of access in our system just makes me incredibly proud.
Excellent. So let's hear from Dr. Fatimi. So my understanding is that the Pride Health Center actually grew out of your own personal practice here. Tell us how that happened and also why it's so important to you.
Sure. It did grow to my personal practice, but I want to say that Richard was one of my mentors, so it really grew out of work that he did here at Gouverneur earlier on, maybe 10 years ago or so when he was a resident. So I have I owe a lot to him. So I'm a primary care physician, and I've always had an interest in LGBT health, and that really snowballed and grew during residency, both when I met Richard, who is a mentor for me, and as I heard more and more stories from the trans community in New York City, unfortunately about really terrible interactions, really disheartening interactions that were happening not just in the community, but also in doctors' offices, in ERs, on inpatient wards. And as a gay woman myself, I think those stories just really hit home even more so than I could have imagined. So my interest in LGBT health really grew a lot during residency.
So we actually already have a question, and it's from Jacqueline. And the question is, how do you make teens feel comfortable? What do you got to do?
For me, I refer them to Dr. Bailey.
That's a good answer. We're gonna get to you in a second. So should we actually just, do you want to talk more about the Pride Center, or should we jump to that question straight to you?
I agree with everything that Dr. Green said, so I think we can go right to Dr. Green.
Great. Well, let me tell them what you do, and then you can answer that question. It's like a perfect segue. So thank you, Jacqueline, for the perfect segue. Dr. Bezier has an innovative program at Judson for teens and young adults. Perfect. Called The Bridge. So can you tell us about that program? And I guess, beyond answering that question, also tell us, who are you seeing there?
Yeah, let me know if the Oscar music needs to go on. Because I wanted to tell you a little bit about the importance of the program, and then a little bit about our unique services that we're offering, right? So,
Great.
Again, my name is Mark Bezier. I work at Judson Healthcare Center. Judson is part of Gouverneur, which is part of Gotham Health. Judson is actually a small community healthcare center in Soho. And at Judson, we have a special program called the Bridge Program that offers specific services for adolescents, but with a unique focus on emerging adults. Emerging adults, loosely defined 18 to 26, 18 to 29 years of age. It's actually a well-recognized life stage in other social sciences and the legal system. There's young adult court in Brooklyn. But for some reason, I feel like healthcare systems may shy away from providing services or a specific focus for emerging adults, right? They think they're otherwise young and invincible and otherwise healthy, maybe don't really need access to routine medical services. But actually, emerging adults are a very vulnerable, at-risk population. They have a lot of psychosocial needs, and that's what we're trying to do at Judson Healthcare Center. Really try to find a place where emerging adults feel comfortable, because they don't go to the doctors, and when they go to the doctors, they've reached a lot of barriers to care, and this is especially true for our LGBTQ young adults, right? Or are actually much more barriers in life and accessing healthcare services, and are even at higher risk. And we all know high risk for new onset HIV, STIs, depression, anxiety, suicide attempts, intimate partner violence, substance use disorders, homelessness, smoking. So at Judson Healthcare Center, we have a specific and explicit focus on LGBTQ youth and young adults. But how do we make them feel comfortable?
Great. I was going to say, let's circle right back. How do you do that?
I think that starts from the front desk. We have an amazing front desk staff, Felicia, who is so awesome with the young adults and the adolescents. Honestly, I come out of my exam room and they're just hanging out with her all the time. I think it has to do with our signage and having affirming signage in the waiting room, and we have your pronoun buttons on the desk at the front. And then I think for teens, you just need to be you have to have a little bit of a laid back attitude, and a personable interaction with them.
Can I second that? I think the team is so important, and I think one of the things about our LGBTQ health centers, the Pride Health Centers, is there are some people who feel really comfortable going to Pride Health Centers and really want to be affirmed in that way, and I just want to make the point, we have a fantastic team also at Bellevue. The other providers that I work with, we have some patient navigators who are fantastic, and people hang out with them also. And also, we have other providers for people who don't want to be specifically in an LGBTQ health center, who still are very able to provide really high quality care. And so I want to give a shout out to them also, because I realized I forgot to say that before. We have some outstanding providers, so it's not like you have to go to a Pride Health Center if you're LGBTQ identified.
You brought up something about emerging adults being at risk for depression and suicide. Does the Bridge offer mental health services?
Yes, currently the Bridge has a young adult psychiatrist that comes out a couple times a month, and next week we have a full-time LCSW starting that is going to be there to provide therapy and groups and concrete mental health services Monday through Friday. So that's really exciting.
That's great.
Yeah.
So we're going to move on to the true star of the show, Stefan. So you recently had a great experience in Metropolitan's Pride Health Center, where it sounds as if you get some care there.
Yes.
Tell us about your experience, and how is it different than other places you've been, other health centers?
Well, I went to Metropolitan to get my chest reconstructed, and the surgery went great with Dr. Aaron Crisell. And prior to me coming out the same day of surgery, I had an accident where I fell, and I went back to the hospital at Metropolitan, and as soon as I got there, the emergency care took great care of me. They sent me upstairs right away because they thought that something would happen to the surgery, to my injuries of me just having the surgery the same day. So they called Dr. Aaron Christelle right away, and they let him know what had happened to me. He reached out to the hospital because he was home, and the next day he came to see me. Everyone there just was like on care with me. Everyone was like, you know, if I need anything, they took care of my mom. She stood over for the whole week I was there. Nothing really happened to my chest as the fall happened. I feel like they examined me from head to toe, making sure that I was stable, that nothing happened to the scars. Nothing happened right here on the nipple area. They made sure that I was gonna be great leaving. My dreams, actually, instead of me leaving it for about 2 to 3 weeks, I had to leave it a little longer because when you get an injury in your body, you have you drain out more fluid. So you have to be really careful with when you get surgery. Try not to like do as much so you won't have to like go longer having those things on because it could feel uncomfortable. The surgery to me was it was simple. It did not hurt. What happened was that I'm not accustomed to the painkillers that was prescribed to me, but you don't necessarily have to take it. I feel like that one day that I took the painkillers, I was under still like the anesthesia and stuff, so I didn't know what was going on with my body. But the next day I went on through curing my body without any medicines. It was just mental. You have to really prepare your body, prepare your family, have everything you're gonna need, especially loose clothing, pillows, and just be on phone call with your doctor for any little thing that you need. You can call him right away and let him know, hey, I feel some type of way. He'll tell you to come in. You can ask these guys. New York City Health and Hospitals is opening up more places where you can get information from if you can't reach your surgeon.
And Guy, I'm gonna ask you one more question if that's okay. So when you walk into a clinical place or a place where you seek care, what makes you feel comfortable?
The welcoming from the front desk. That's the first thing. If you get welcome when you come in to any hospital, any clinic, and they happy to see you, that's a good hospital, that's a good clinic. If you come in and they just say, here you go, without like, you know, explaining anything to you, or like saying, hey, look, this is what's gonna go down, the waiting is this much, you're gonna be seen by this person. When they give you detail to detail, then you're gonna wanna stay at that place. When you feel neglected is when they just say, hey, here, and like you go back to them, like the receptionist, and ask them, hey, I'm confused with this question or something like that, and they just say they don't know. I feel like you should go somewhere where you know they have more information and they can relate to what's going on with you or any questions you have for them.
Great. Any comments from these illustrious physicians that do all the work? Sounds like what you said is what Stefan said.
Yeah.
Well, there you go. Sounds like a good match, ultimately. So I guess one question that people, that comes up a lot is really beyond what you have within your clinics, what do you do to reach out to the community? So how do you get the word out that you have these fabulous programs? So I think I'm gonna ask you two to start with that, and Richard, you can chime in.
You wanna start?
Yeah, I mean, we have an awesome community health worker, Win. They've been around for the last couple of months, woo! And really going out to different outreach events, identifying outreach events to go out to, rallying up the troops, and actually Win has really been a part of our care team and part of our department and really helping us out at Judson. Yeah, so we have a wonderful community health worker. We've also made a really good connection to some community-based organizations. So the center, we have a great partnership with the center. They send a lot of their patients or their clients over to us for medical care, and we send a lot of our patients over to them for support and some programming. So Yeah,
That reminds me, we're going to have to invite you to our Department of Health Red Ball around World AIDS Day so you can meet all of the kids that come in vogue in the competition. We have about 1,000 of them. So I think your outreach would be really, really great.
Amazing.
I won't forget. That's a really good one.
Yeah, so the 3 outreach workers we have in the system are really excellent. You can email them. It's the same email address. It all goes to the same place, lgbtq@nychc.org. I think the outreach workers are doing their community outreach. What works well for me is to talk to the community partners that I already have or we already have, especially those personal connections, and really showing up to their events, showing up to protests, showing the community that I'm part of the community. I'm not just here 9 to 5 or not just here for the clinical hours, but this is part of me and part of what I do. That's been very effective. As well as outreach I do to specific doctors that I've either trained with or I know well. I know how they've been trained. I know how they interact with patients. I know that I could trust them, with my family members or with my patients. So outreach like that, one-on-one, it goes both ways. And so if they are, let's say, taking care of somebody in the hospital, and they know that person needs a primary care doctor, then they might refer them directly to me.
Absolutely. I mean, we have a couple of really fantastic patient navigators at Bellevue. We have a doctor who recently started working with us, Dr. Robert Pitts, whose picture you can see all over our Facebook profile, has done fantastic outreach. We've partnered with the DOH Sexual Health Clinic in Chelsea, and we're getting referrals from them and from other places around. And some of the patients that we see are vulnerable people and have a really hard time finding, even if they identify LGBTQ affirming providers at other places, can't necessarily afford to see them. And so having people know and be aware of the services that we provide and that we can see people with different types of insurance and also who are self-pay can be really helpful.
Yeah, I agree. I think quite a few of the people that I see in my clinic these days, they've come through that main email line through the system because they're either new to New York City or they lost their insurance and they have never interacted with health and hospitals before, but they know that we are a system who can help them, and they find their way to that email address, and the person who monitors that email will connect that potential patient with those of us who do provide affirming care and give that person the option of what's closest to their house and what they feel comfortable with.
Can I share an anecdote?
Anecdotes, you're welcome. Yeah.
So one of the stories that really sort of gets to my heart is that I have a patient who I was sitting in my office one day. This was back when I was at Guggenheim and running a clinic here. I don't know how he got the office number that I was sitting in, but that was the number that someone gave him. And so I picked up the phone myself at 6:30 at night. And he at the time was in his 60s. He's now in his 70s. He's still my patient. And we've been through 10 years of care together. He's an older cisgender gay man. And he became tearful the other day and gave me a really big hug and said, "I can't believe that I got so lucky that you picked up the phone." And so people are really looking for this kind of care and don't know how to find it and are looking for that connection that makes them feel safe.
I mean, as a patient at Bellevue, I'll tell you that it feels really big, but you all make it feel the right size. So that I think is a testament to all that you do. That sort of, you walk in the building, don't be scared of walking in the building, because once you get to these environments, it really feels like a family. So I can't overstate that. That it's remarkable, sort of the work that you all are doing to sort of make the city's, flagship facilities be so welcoming to LGBTQ people. So I commend you. So I guess, speaking of LGBTQ people, I think some folks debate about whether there is a need for there to be really a specialty care for LGBTQ AI plus, I guess we'll go beyond that, people. So what are your thoughts on that? We'll start that way. We'll start with Richard.
Sure. It's a really complicated question. On one hand, I'm someone who has chosen to specialize in this and I believe in it very much. And I, like Mina was saying earlier, I'm a part of this community, and it's one of the reasons that I went into medicine in the first place, is to take care of this community that I love so much. And there are a lot of people who feel the way we do, that going to someone who you can identify, who's LGBT identified or affirming and really cares for our clinic or our community is really important. I think the risk of saying that we are specialized is that you can't get care from other people in our system. And I think we have particular needs, every different letter of the acronym. But I also think that there are lots of really good providers out there, and it's standard primary care. The shame is that a lot of people don't know that.
You're up.
I don't think it's specialty care. When I think of specialty care, I think of a very small set of physicians who do their training, and then they see patients for their career that just fit into that one specialty area, whether it's a certain part of the body or a certain way of interpreting health, and they just really get to see that small slice. So I don't see this as specialty care, but I see it as a specialized skill set. And by that I mean it involves a certain level of training, practice, of course mentorship, but everybody can get that specialized skill set. It's not just for this small slice. And the beauty of that is that people like us who are pediatricians and internal medicine doctors, we can integrate LGBTQ care into our primary care practice, because that's really what it is. We take care of all of our fields, we take care of the whole person, and LGBTQ people are people first, and as much of them is their identity, we understand that we take care of the whole person.
Yeah, great. Yeah, there's no specific illness or condition associated with LGBTQ patients or populations. You know, a lot of our risk and the health disparities stem from the stigma and the discrimination that the LGBTQ communities go through. So I don't think it's specialized care, but patients need to know that there are affirming providers where they can go to, and they can really talk about their sexual orientation and their gender identity, because that's very, very important.
I'm going to ask the person who really knows the answer, Stefan. What do you think? So I know that they have a lot of opinions, and I want to know from your perspective, do you think that folks require like some sort of specialty level care?
I feel like it's not as special as people might see it. It's just that they're not in our shoes, so they might think that we get special care because of how they treat us and stuff like that. I just feel like they have their own thing, so why not we have ours, you know? You guys do so much research for us that it's easy to just come to you guys instead of going to like a regular clinic or a regular hospital where they might not know the information we need. So going to like a health center for LGBTQ community, it's not special or anything. It's just like we feel like they're gonna provide more care, more information, be well towards us, and like really care for like the things that we need.
Great.
And I just want to say also, I think that specialized skill set that we have, and plenty of colleagues of ours have also, we need that now, because we're not yet at the point where people can go to any physician and expect that they're going to get affirming care. I hope that's what we're going towards, but the state that we're in now, it does still require that specialized skill set.
I can't count the number of times that patients have said to me, no one's ever asked me these questions before, or no one's ever asked me about these kinds of treatments or screenings or prevention before, and I'm glad to be the person who can do that.
So sort of sitting here with what in effect is, at least, we have like we've met for the first time, but we have technically 3 trainee generation experience here, because I trained you,
Yes.
and you trained her.
To be true is my attending.
It's true.
I was mean as attending.
So let's
And now
talk
he's my
about
patient.
because I know who I trained.
Yeah.
Very good.
I literally said on day 1, I was like, I'm just gonna do what you taught me, and he said, great.
So I guess the question then is, for all of us, what can we do to sort of pay this forward? Like what can we do to teach other providers how to cultivate these skills, and if providers out there are seeking to find these skills or to cultivate these skills, how should they do it? How can they learn to provide both LGBT affirming care and also LGBTQ plus enlightened care? So not only about being affirming, but also doing the right medical stuff. What do you all think?
I I think we've probably all been through this, trying to make our specific program and our specific departments more affirming. You know, it's not just the providers, but it's the whole care team, the nursing, the front desk staff, the medical assistants. So I think you really have to keep it as part of the conversation, make sure that people realize mistakes are going to be made, you know, but not to keep trying to do better in the future, and really let the patient drive the conversation. I think a lot of staff are afraid to misgender, mispronoun, or oh my God, I don't know it. But if you just really ask the patient to drive the conversation and use the language that the patient's using, that really goes a long way and helps out. You know, so yeah. So I think keeping it part of the conversation
So
and really.
So if I can say something on that,
Please.
there's a specific clinic that one of my friends go to, and they ask me a question like, what's the difference between your clinic and the clinic I go to? And I tell them that, you know, they provide this and this, and she goes, well, why can't they? So I explained to her some of the things that I feel like she should speak to with them if they want to open up more the LGBT community, from like experiences from you guys and finding out resources from Metropolitan and stuff. And I pushed information from my knowledge to them so that they can be able to like get more social with us and maybe branch out this community.
I think for me, when I have colleagues who are specifically interested, I point them towards a few particular resources like the online trainings at Fenway Health Center, which Health and Hospitals has partnered with to offer a few different trainings, to WPATH, which does an excellent conference. And then the other side of that, I think on the more day-to-day level, which is something that was modeled to me by Richard, is the availability. So when somebody that I work with, a colleague, has a question particularly about trans health being accessible to them, and also to colleagues and our clinical team normalizing that I don't know the answers, we don't all know all the answers. It's not if you make a mistake, but when you make a mistake, when I make a mistake. So I think demonstrating to people that you know, it's something that we're all working at, and they should kind of not be afraid to step into it.
I will just say that Dr. Fatimi is my greatest success. So I feel so proud, and truly, I think to also say that many of us also have academic roles, and we teach the next generation, right? That's how we ended up in the place where we are, having taught each other. And I was really privileged a couple of months ago to have a trainee who I have known since she began medical school say to me, I guess I never thought of how hard it must have been for you to try to start introducing transgender health into a standard curriculum, because you've been teaching me since I started. And so while I never heard the word transgender in medical school, she has been hearing it since day one from teachers like us. Mm-hmm. And so that's how change happens, right? We affect the curriculum, and we affect it in our patient care, and as Dr. Fatimi pointed out, setting expectations of our colleagues that this is not too complicated for you to know, and it's not something that you're not expected to know. It is standard primary care, and you're expected to know it, and I'm happy to help you get the knowledge.
And in working with trainees, it's not just when we do the 1 hour session on trans health or, you know, this isolated thing. It's when we talk about, you know, any given topic, getting LGBTQ health in there in a sort of frequent, small exposure, but frequent exposure, especially with medical students. Just if there's 5 minutes of downtime before something, giving a small teaching topic or talking to them about trans health or LGBT health. I think that's really the way to do it.
So as the grandfather of trainees up here, I'm really impressed with that. I think I'm just going to add one thing, and then I'm going to ask you all for parting shots, all of us, which is I also try to make sure that the folks that I train know that like they cannot look shocked when someone tells them anything about their lives, whatever it is. So I always tell them, and I think you'll remember, to check your face, because if you are shocked by something, people get interested in not talking to you anymore.
Right, yes.
So yeah,
Yes.
so check your face advice is really good training
advice. It happened to me
advice.
before, you know, I asked a question, you know, something very personal, and they really didn't know what to tell me. They was like, so I'm like, you know what, maybe I should go to someone else, because I feel like whatever question, whatever answer that person is gonna give me might not be truthful. So I'm not gonna continue to pursue to want to know what he's gonna tell me, I'm just gonna like move on from there. So if you feel like they gave you a different like perspective of what you was looking for, then might not be the person to ask the question to.
I'm going to give you the last parting shot. So we give everyone a chance to give a couple of sort of ideas at the very end, since we're almost out of time. Please tell me, what is your parting message to our viewers on Facebook? Not to put you on the spot.
To come to Health and Hospitals. To call this
Done.
number.
I got
Number.
you. We got you. Stay tuned, and I'll repeat the number and email.
No,
That's good advice.
there's wonderful affirming providers and affirming centers in health and hospitals, and where you can come and feel comfortable and get some high quality care. So give us a call.
I think I want people to know that even people who feel well, who have no health problems at all, should still have a primary care doctor. They might not need to see us every 3 months or every 6 months, but we should all be able to find somebody we feel comfortable with who is our doctor. So even younger people, people that are older, people who have no medical problems, they should still find someone they trust.
Sure.
I'm going to go a little more personal than that. I consider it a real privilege to take care of people in our community, and I'm as invested in my patients as they are in me, and I feel amazing at the end of the day that I get to go home having taken care of our community. And so come visit us, we're here for you. And we really care, right? That old school doctor experience that I feel like is going by the wayside in corporate medicine exists at health and hospitals, and that's why we have set up the centers that we've set up.
All right, Stefan, you get the parting shot.
No problem.
The reason why I recommend New York City Health and Hospitals is because you can find everything in one instead of having to go to a specific clinic or something. Every answer you need, they will provide to you. Any resource you need, if you can't find it yourself, they will assist you in doing so. You can come here to New York City hospitals because they're gonna just show you different ways on how to like open up and not be afraid to like get the medical needs you are looking for.
Great. So now let's talk about how you can do that. So for appointments, you can do a couple of things. There are a couple of numbers you can call: 1-844-NYC 4NYC or 1-844-692-4692. Another option, if you really have any questions about all of the amazing LGBTQ plus services here at Health and Hospitals, you can also email at lgbtq@nychhc.org. Thank you so much for joining us on this very important Facebook Live, and thanks to all of the panel for your amazing insights into this important area.